I'm seeing a lot of content about IV glutathione and its skin brightening, hyperpigmentation, reducing effect. Can it really turn my skin into porcelain white skin? So IV glutathione is something that we use as an antioxidant for inflammatory conditions at SeeBeyond Medicine. But at SeeBeyond Beauty, we do use it as a glow IV, and we can produce some glowing and brightening effect using glutathione. However, IV glutathione's effect on skin is real, but it's over-promoted, and it ends up being that we end up setting unrealistic expectations in our patients because in Asia, or particularly in Korea, glutathione is often referred to it as snow white drip. And can it really turn your skin into porcelain white skin? Probably not. Glutathione is our body's master endogenous antioxidant. Our liver synthesizes it from amino acids like glycine, cysteine, and glutamic acid, and it plays a central role in making of the melanin, which is our pigments. It competes with tyrosinase, and when there is glutathione, tyrosinase activity goes down, which means it cannot produce the eumelanin, which are the dark pigments. The pathway shifts into producing pheomelanin, which is the lighter pigment. So over time, gradually, brightening effect of your skin can happen. And this effect is very well documented in literature, and I've certainly seen it in my practice. But the reason why I said no to your question is that to turn your skin that bright and glowy, you really need to be doing it weekly for 90 days. That's a lot of IV to be doing, and it can never really take away your original skin complexion to turn it into a snow white skin. Then comes the question, how much can it change? The clinical variable here is the bioavailability. Are you taking it orally or are you getting it as an IV? And how much glutathione are you actually getting? Oral glutathione is poorly absorbed in its intact form because the tripeptide is degraded in the gut before it reaches any kind of systemic circulation, and IV delivery bypasses this degradation entirely. Definitely clinically better. At SeeBeyond Medicine, IV glutathione is typically not a cosmetic whitening treatment. I use it primarily for its systemic antioxidant and liver protective effect. I use it in our detoxification protocols, and I use it to reduce tremor and Parkinsonism patients. The skin brightening effect is documented as a secondary outcome, and you need at least 3 months to see a sustainable effect because that's how long it takes for your skin to turn over and your cells to turn over. And it will not sustain if you continuously are out in the sun, not using your sunscreen protection every day, and if you're eating sugary, inflammatory, processed food. So your lifestyle certainly has to match the IV or the oral supplementation effect that you're doing. At SeeBeyond Medicine, I evaluate whether IV glutathione is appropriate for your specific situation and whether or not realistic outcome can be reached depending on your lifestyle, skin tone, and health status and the treatment goals.